doors of any regular mainstream schools asking for admissions. The main focus is, being a parent, it is our duty to check where exactly our child lies. What is the fitness of our kid in that environment? Is it a frustrating situation we are giving it to the child and to the parent as well as to the teacher and faculty? Is our child really prepared for that environment? If there is no readiness, if there is no preparedness of classroom, it literally doesn't matter whether your kid wants to stay in a normal school or a mainstream school or as integrated or inclusive or isolated in a special school. With this, throughout my observation, one thing I realized, if I want a child with developmental delay, ADHD or the extreme autism, first and foremost is prepare the child as an integrated model. I do not agree with the fragmented way of teaching. I do not agree with my kid wants speech therapy, occupational therapy, or behavioral analyst supports for their hyperactivity, language and social skills as a fragment. No. For this very reason, over 2 decades, I have evidence-based implemented approach in my day-to-day practice, which gives excellent outcome with each and every goal-oriented activity. And the beauty of this is it is an holistic approach, integrated, everything under one single setting, where you will be controlling the behavioral deficits. Cognitively, you will be giving the ways to think and reason, bring problem-solving skills, bring in them the life skills, remove the emotional coldness, what we call, as well as speech and language and social skills. It is such a beautiful approach. Definitely, I will not be able to describe on this platform, but it is the practice what I have done, what I am every day doing in my center, where people are approaching me not only from my state, Mysore, where All India Institute of Speech and Hearing is situated. For this very reason, people are approaching for the diagnostic purpose from all over India. And I'm also getting children who are settled overseas, Indian parents definitely, those who come to know about my approach and the outcome. And I already said, I have my own testimonial. My twins, those who are on different spectrum, they were never been same. There is a saying, we always try to differentiate. She's mild autistic. It's a borderline autism. If you ask me, if it is not typical, neurotypical kid, whether it is mild, moderate, or severe, it doesn't matter. Autism is autism. Either you live with that or you work for that. And that is the main thing what I took when I got the diagnosis in my hand. I accepted it, probably not fully, wholeheartedly, which no mother can do it, but I took the symptoms, science, symptoms, I worked on it more than the diagnostic label. And this is what I every day tell to my parents who visit to me. Don't see the broad label and be scared. Look into the potentials, skills. I'm not saying giftedness, because we need a holistic individual with a good personality. When a child walks in front of you, you should not able to identify whether it is a special need just by seeing its walking gait or personality. So that type of approach I have researched, I am practicing, where I am giving all context equal importance, whether it is sensory sensitivities, desensitization, or behavior, emotions, cognitive skills, everything under one setting. It is not just therapeutic approach, it is therapeutic academic based approach. And that is the very reason parents feel very happy, very comfortable. They do not feel that, my child is going to a therapist. They feel that my kid is attending a school, a classroom environment where even we start assembly, the simple exercises, rhymes. We may wonder there is no language how the child can imitate. But this is what we try our best to bring imitation, observational learning, all these things. So this is how actually Dishaa Foundation works on children with autism. And I would firmly say, if we start at very early stage, and when I say very early stage as early intervention, the main problem here is stigma. No one wants to say that your child is identified or diagnosed as deviated. Name it anything. Developmental delay or autism or ADHD. So the best thing is, we need to bring screening procedure at certain age level. Say, for example, autism, when you say, it is usually by the age of 18 months, it is quite visible. A few couple of words will be regressed. The hyperactivity, the language, the emotions, the behavior, it's all, very clearly seen as symptoms. And when you see this, what you actually need to do, say at around age of 2 years, systematically a pediatrician, as we have vaccination schedule, if there is a screening protocol, no one is literally left behind unidentified. This is one thing I would say. And second thing, as per my observation, if at the age of 3 years, when kid is ready to go to pre-nursery, if there is again another screening, that will be a second step, as well as at the age of lower KG, upper KG, that is KG1, KG2, kindergartens. If that kindergarten level, if we are going to screen as third screening, I'm sure even learning disability children can be identified. Because we say up to the age of 6 years, you cannot literally identify LD. And that is, dyslexia or whatever we call as learning disability. So with this step-by-step, stage-by-stage screening procedure, no one will be left behind. And even if someone is identified and detected, we can address them very easily to the parent, saying that, look, your kid is something which is not as typical as it comes to our eyes. So let us work on it together as teacher and parent, triad. And here, even the teachers, when they are able to screen the children, when they're trained for that, screening as well as later on for training these kids. This is what the structural gap we need to really,
Thank you so much, ma'am.
Yes.
You are addressing each and every corner and aspect of what should be discussed when we talk about inclusive practices, inclusive education. The word you have given, it should not be only therapeutic, it should be therapeutic, academic approach. Wonderful. One question which is related to ma'am's question, and now it is the extended part coming to your basket, and it is really close to my heart because being a mother of an autistic child and being a principal in a school, how do you ensure that inclusion doesn't slow down the overall peace of the classroom.